The head of the nation's top public health agency announced a shakeup of the organization as criticism grows over the response to COVID-19, monkeypox, and other public health threats. Public trust in the CDC has dropped dramatically during the pandemic, and some say recent updates have caused confusion.
CDC guidance sort of relaxes a lot of the restrictions we've had. Tells us that there's a really new way of thinking about who is going to get infected. We used to spend a lot of time talking about 6 feet of distance, 15 minutes of being together. We realize that's actually not the right way to think about this. That's not the kind of the most accurate way to think about this.
Changes at the CDC include internal staffing moves and steps to speed up data releases. Officials hope to have changes underway by early next year. A new review finds a lack of high-quality monkeypox guidelines may be hampering treatment of the infection around the world. The analysis in BMJ Global Health finds the existing guidance doesn't often have enough detail, rarely provides advice for children, and is often inconsistent. Last week, the FDA changed guidance on the way the vaccine should be administered in order to stretch the nation's limited supply. That drew concerns from both vaccine producers and physicians. The FDA is establishing a new category of over-the-counter hearing aids. The devices will be available for purchase without a medical exam or a prescription. They could be in stores by mid-October. And if you're struggling to remember something, new research suggests just reach for your phone. While some experts believe too much tech can lead to digital dementia, Ian Lee explains why scientists in Britain think phones may actually improve our memories.
Cell phones might seem like they're glued to our hands with the constant messaging, talking, and scanning of social media. So scientists in the UK wanted to know how that affects our brains.
We were interested in the way that people use devices like smartphones as an extension of their memory.
Dr. Sam Gilbert led a team of researchers from University College London. Using a computer program, 158 volunteers were given a memory task to do 16 times. For half of them, they had to rely on their own memory. For the rest, they could set reminders on a digital device.
When people have access to a digital memory, they offload the most important information into that digital memory. But this, in turn, frees up space that we can use to remember additional information.
So your important information is only as good as your battery life.
That's right. So you need to make sure that your devices are reliable.
Some folks agree digital reminders help boost their memory.
I would put in my dentist appointment, but I'd also then remind myself that also my husband has one and my son has one, so I need to make sure that they go to theirs.
Others aren't convinced.
No, because I just have everything written down.
But researchers say remembering to outsource your memory just might improve it. Ian Lee, CBS News, London.